Laro, the Director General of Health Services at the Ministry of Health, sepsis remains a hidden epidemic that requires urgent attention from both the public and health workers. Sepsis, often referred to as blood poisoning, is a life-threatening condition that occurs when the body's response to infection causes injury to its own tissues and organs. If not detected early, it can quickly lead to septic shock, organ failure, and death. This year's commemoration is under the theme Voices Against Sepsis, highlights the need for collective action, and government is prioritizing emergency care, training frontline health workers, expanding access to antibiotics, and strengthening laboratory services to support early diagnosis and treatment.
To take actions against sepsis, a silent but a deadly condition that kills millions of people worldwide each year and kills much more than even HIV, malaria, and breast cancer combined. In Uganda, maternal and newborn sepsis remains one of the leading causes of death in hospitals, yet most of these deaths are preventable if recognized early and treated promptly.
Sepsis is when the body's immunity has been overwhelmed by an infection that can get into the blood via having initial an infection on the skin or through any crack from the skin or through an infection like pneumonia, and the body gets overwhelmed and these organisms or germs overmultiply in the blood, and the body then overreacts to these organisms. They react beyond the germ. They also start affecting and reacting against its own organs like the liver, the kidney, and the more they react and break down, they produce chemicals like cytokines.
But we need to give them, first of all, information, but also we need to improve diagnosis at community level. There are many people out there who do not have the information we have, and they don't have the opportunity for diagnosis.
We request you to report and document sepsis cases to improve surveillance and response, and above all to champion infection prevention practices in your facilities. To development partners and implementing partners, our support is vital. We need to invest in strengthening laboratory networks and point-of-care diagnostics.
A National Female Youth Member of Parliament, Fiona Nyam